This is Crystal Fend with MedPage Today. I'm here in San Francisco at the American Society of Hypertension meeting, where researchers have reported that for cardiovascular protection, any class of antihypertensive medication may be a good choice for initial treatment. Researchers led by Dr. William Elliott from Rush Medical College reported these findings at a press conference.
So the conclusions from the stroke analysis is that both the network and the Bayesian method give you the same answer. All drugs are significantly better than placebo. Okay, looking at all the data that we have, anything, everything, all drugs are better than nothing or placebo. And it turned out that for stroke, diuretics and calcium channel blockers are slightly better than ARBs and significantly better than ACE inhibitors or beta blockers, as I showed you before. And it doesn't really matter what kind of what kind of changes you make to the base case. It turns out you get pretty much the same answer all the way through.
The findings were similar when looking at coronary heart disease risk.
All drugs except ARBs are significantly better than placebo, and I call this a power issue because, as I mentioned, we don't have the same number of patients, we don't have the same number of trials, we don't have the same number of people with heart attacks with ARBs as compared to the other classes. So you're trying to compare the low-rise elevators here compared to the high-rise elevators, and there is a difference. And you'll find that out if you try to get to the view using the low-rise elevators. Second point is that it turns out ACE inhibitors are significantly better than ARBs or beta blockers, and that actually echoes some of the allegations in the medical literature that says that ACE inhibitors have this particular propensity to save people from heart disease. And there are some people who believe that that property is in fact independent of their blood pressure lowering effects. We can't address that here, not with these methods, but nonetheless it is at least consistent with that hypothesis. The answers are pretty consistent, no matter how you put in and take out trials, you get pretty much the same answer. And I think that's a very important message for patients and for doctors, because it says that the medicines we have work in reducing stroke and heart disease risk.
While these findings were reassuring, Dr. Elliott noted that nearly all hypertensive patients end up needing 2 or more antihypertensive agents after initial therapy to control their blood pressure. Here in San Francisco at the American Society of Hypertension meeting, I'm Crystal Fend, MedPage Today.